In this video, we're going to demonstrate how to perform an intramuscular injection or an IM injection. And this, this order is for 6 mLs IM of morphine. And what we're going to do is just make sure that we've got all of our supplies at the in like the med room before going into the patient's room so that we can administer it. So I'm just going to make sure I've got my alcohol swab, I've got my medication, my morphine, I've got my syringe, my needles. You want to make sure that you've got the appropriate syringe and needle. You know, you don't need to be jabbing into your patient's muscle with a 16 gauge or something crazy like that. So, you know, use the appropriate. But for the sake of this video, we're going to pretend that this is a 12 ml syringe, and that way we don't have to go and do 2 injections here because we've only got 2 5 mls and it calls for 6. So we're just going to pretend that this will accurately read and accommodate for 6 mls, which it in real life does not. So we've got our syringe here. This is the biggest one that was applied in our kit. So that's what we'll be running with. And so I've got all of my supplies, and I am going to now head over to my patient's room and discuss everything with them. So I get up to my patient's room, I knock on the door, I gel in, I walk in, shut the door behind me to allow for some privacy, introduce myself. Hello, my name's Michelle, I'm going to be your nurse, or I am your nurse, or hello again. The doctor ordered some morphine to help with your pain relief. I just wanted to do a quick verification. Can you please confirm your first and last name and date of birth? I'll also make sure that everything matches up with your ID band on your wrist, please. Everything checks out. Especially important to verify this information because now with electronic health records, we're doing a lot of scanning of ID bands to medication vials. I know at my facility they do. And so it's important just to make sure everything matches up exactly. So I've verified my patient. They are who they say they are who this order is for. I am now going to, with the patient at the bedside, go over their allergies and make sure that this medication is not contraindicated for them, that they don't have any hypersensitivity to morphine or, you know, really central nervous system depressants in general. And then we also want to make sure that they're not, you know, taking any MAOI therapy, and also that they don't have any addiction problems. Because this is a narcotic, there is a high chance that they could become addicted to it, especially if it was something that needed to be used long term. And so that's something that you definitely want to dance around a little bit more cautiously. And, you know, if necessary, maybe change medications to a different drug that can still maybe help them with their pain, but not necessarily throw them into a spiral with their addiction problems. But ultimately, we need to make sure that our patients aren't laying in bed in dire pain all day. The least we can do is trying to make them comfortable. So after we've gone through, we've addressed that there is no allergies, there isn't any other contraindications for giving this medication to them, that it's safe to give to help with their pain. We also want to first, before administering and while we're sitting here talking and we're in the chart, what's your pain score? What is it at right now? We want to be able to see beforehand what it was, and that after giving it, you know, allowing 15 minutes or so for it to at least start to set in. We want to make sure that it's actually doing some good for their pain. If it's not touching it, maybe they do need some other medication. So that's very important too. Make sure to get their pain score before starting administration, before manipulating them and doing anything else. So we've gone through all of that. We also want to make sure that they know the reason why they're getting this medication. Ma'am, I'm giving you this medication because you're sitting here in pain post-op from, you know, a total knee replacement or whatever it might be, and gallbladder removal. You know, this will help with your pain. Would you like to have it? They don't have to receive it. It's solely up to them. So, you know, make sure to get their consent, and that everything kind of is falling in line for giving this medication. So then we want to go in and start addressing kind of the side effects and make sure that they know what to expect with this or what could happen with this, you know, on the normal and common side, but also on the severe end. They need to be well informed, and you should be well informing them of each medication that you're giving beforehand. So we would want to go and address the fact that this medication is a central nervous system depressant. It's going to help with their pain, but it's also going to potentially make them dizzy and lightheaded, and they probably shouldn't be driving on it. Not probably, they really shouldn't be driving on it. So if they're not in the hospital or they're not staying there, maybe it's outpatient or something, you need to make sure that whatever happens thereafter, they're safe. And you definitely can't give this medication and just send them on their way. They have to stay with you. And I'm pretty sure it's for like at the very least, 45 minutes you need to monitor them. Because also what you worry about is that respiratory depression. It's a depressant. So everything kind of starts to slow down. And you'll see that with, you know, from breathing to cardiac, they could, you know, beyond apnea and respiratory depression, they could have cardiac arrest, they could have seizures, they could go into shock. And so these are all things that you really need to keep a close eye on after giving the medication. You should never give an opioid without putting your patient on the monitor and monitoring their oxygen levels, especially if they're already kind of drowsy or sleepy people to begin with. You want to make sure that when they go to sleep, they still breathe. So super important. Make sure to monitor them. And let your patient know about all these things. If they start to get, you know, shallow breathing and things like that, or if they start noticing any reactions, make sure that they have a call light so that they can reach out if they start to notice things early. And so after addressing all of the, you know, common side effects, severe side effects, we're going to just make sure that our patients don't have any questions or concerns after. So I'm going to, you know, ask them, hey, now that we've gone over all this information, is there any questions that you have? Any concerns? Do your family members have any questions? Perfect. No? Gave you all the information you needed and you feel comfortable, you're well informed. Fabulous. That's what we want, a well-informed patient. So I'm going to go ahead and once again perform hand hygiene, because I did it before walking into the patient's room, but now I want to make sure that I do it before actually touching and putting hands on patients. I've been touching the computer and charting and all of that. So we want to make sure that everything is here. So of course, with any medication administration, we're going to make sure we have our 6 rights. And we're going to make sure, you know, everything that is there at bedside is needed before we really dive into it. I've got the medication, it's the correct medication. I've got the patient, it's the correct patient. You know, the dose I am cross-referencing here. We established it's 6 mils IM of morphine. We're going to pretend this is a 12 mil and that just past 5 is 6. And that it's not expired, the vial, everything looks great, it's not compromised. And the time is correct. We're allowed to give this medication. Nowadays, you know, you can rarely, especially with electronic health records, give a medication or even access it before it's time, unless the physician allows you to, or, you know, PRN. So we're just going to make sure everything is prepped. I had done hand hygiene. I'm going to don my gloves for safety, both for the patient and myself. And at this point, before I start manipulating with the patient, I also want to just draw up the meds so it's nice and ready to go when we've identified the location that we're going to be giving the injection. So commonly we like to give IM injections in the deltoid, this muscle right up here. You want to make sure that you're bypassing all your bony prominences, so the acromion. You want to go just below that, so in this general area. Now, for the sake of this video, we are going to be doing this injection in the ventrogluteal muscle, which is on the hip side down here. Let's see if we can. It's going to be right here. Whoop. And the most important part about this is to just make sure that you are identifying your landmarks appropriately before getting going. So we're going to make sure that we have the patient on either side, right or left, and your thumb, when you place it on it to start identifying the landmarks, your thumb is going to be towards the anterior side of the patient. You're going to be pointing it towards the front side of them. The rest of your hand is towards the back side, the dorsal side, posterior, whatever you want to call it there. So, and what you're going to do is you're going to find the landmark by locating the, great trochanter. And once you're there, you're going to line up your index finger towards the anterior superior iliac spine. And with it, once you've got this line, your index finger lined up, you're going to create a V. And you're going to kind of just bunch these three fingers up together and create the V right here. If you're in the right spot, this is going to be the location of your injection on that ventrogluteal muscle. And that is how you can most accurately avoid hitting any nerves or blood vessels or something that might cause a patient extra pain. So you want to make sure that you're identifying those landmarks appropriately and creating the space appropriately and where it should be if you're lining it perfectly on that anterior superior iliac spine, okay? So that's what we're going to do with our patient here, and create a V, and whoops. Ideally, you'd be lining it up. Let's say this is it, the iliac spine. I lined my finger up and, created that V. And so this is going to be our spot right in here. And so while I have my hand on those landmarks and everything in place, I have everything ready. You're going to be cleaning that area. Once again, keeping your hand right there because you want to make sure that you don't lose that injection site. Then you'll have to go back through and, locate your landmarks again and make sure you're taking the special precautions to make sure it's the right spot. You go through, you're going to clean. I have my medication here. Let me just get it. Okay, so, hold on, excuse me, I need to get this out of. We'll find that landmark one more time. Make sure that I don't have the biggest blunt needle. That would be not nice. Very, very not nice. So once again, anterior, superior, iliac spine, creating the V. It is clean. You can ice the area for them. Once again, if they're really sensitive, be a nice nurse. For the sake of argument here, we are going to say that this is a full 6 mils so that we don't have to do 2 injections into this patient. That would be very mean. We're going to say this is a 12 mil vial and that the medication in here, so also it doesn't overflow onto my bed. So I'm going to safely remove the cap here. You can just kind of toss it off. And with that location, this is awkward not doing it on a real person, you're going to go in at a 90-degree angle and go in. Oops. And that V there, that was nice and clean. And what you want to do first is aspirate to make sure that you're not pulling back any blood. That's just to verify that you're not in a blood vessel, you're in a good spot, it's in the muscle. After a little aspiration, you're going to administer the injection or the morphine, 6 mils. And the rate of the injection should be about 10 mils per second. 10 seconds per milliliter. There we go. I said it backwards. I knew it didn't sound right. And so we're just going nice and slow. Also, because this can give a really like waterfall feeling, like whoosh right over them. So you don't want to make it hit harder than it needs to. Some people also like to slowly inject this with their, if they're getting like saline or something, they'll use the access to kind of put it in if it was going to be IV route so that it doesn't hit too hard. So the injection went in, we went nice and slowly, 10 seconds per each mil, ideally. And this is leaking all onto that. Oh, this is odd. Okay, I'm gonna leave that right there. Good thing I didn't play with this beforehand. So after doing that, we're just going to make sure that we get rid of our sharps in the appropriate reciprocal. These don't have little safety caps to flip up. In that case, you just want to make sure that you safely reapply the cap like so and dispose of it into a sharps container. Also, after administering it, I'm a little scared to take this out because I don't want it to leak everywhere. So let's go like this. After administering that, you want to make sure that they don't rub the area. We can just, if there's a little, blood or something, you can take the alcohol wipe and you can wipe it. Or take some gauze and lightly dab it. But, once again, we don't want to massage the area. I want to let them know not to massage the area. And after that, the patient has received their medication. I'm going to put that in the bag so it doesn't leak all over the place. I don't need red dye everywhere. And we've now completed the injection. Make sure that your patient's feeling okay. Make sure that they're on the monitor. You've got them on, monitoring their oxygen saturation, muy importante. And dispose of your gloves, hand hygiene. Make sure your patient's comfortable and that they don't have any questions and concerns. And you are all done.